Keeping our muscles strong and healthy is very important for circulation, mobility, and just general health and wellness. You've probably heard that saying, use it or lose it. Unfortunately, losing muscle function and strength happens very quickly. It can only take 2 weeks for you to start to lose muscle function and strength. Stay in hospital, being unwell for any length of time, and also if you've reduced your general physical activity levels. For many people with chronic kidney disease, loss of muscle is a real issue. This can affect not just your general mobility, but also your energy levels. It is a challenge to build muscle back up and definitely doesn't happen overnight. But with some simple basic exercises, you can slowly start to build that strength that you may have lost. Remember, we need our muscles to work to do simple things such as get us off the chair, to shower. This is what we need muscle function for. Especially those big muscles, our muscles in our buttocks and thighs and tummy areas can really affect our mobility when we are trying to do those day-to-day activities, such as getting out of a chair, getting in and out of bed, or even showering. Unfortunately, there are a lot of strength exercises that may be not suitable for people who are having dialysis treatment. So for example, exercises such as push-ups, sit-ups, pull-ups, or even using heavy weights over 10 kilos can have an effect on your fistula or your catheter. So it is really important to be mindful about which exercises you're doing. The exercises that we're going to do allow you to build strength without putting any risk on your access for treatment. They are really simple exercises, but will actually really help on building that strength that you've lost. So once again, most of these exercises can be done sitting in a chair, or you can do them standing. I'm going to show you the seated option. There are also some laying versions of these exercises, which we will also show you what you can do. So the 2 pieces of equipment that you can start off with is an exercise ball. Now this is a little plastic children's ball that I picked up at the $2 shop, and this is a fantastic piece of equipment to be able to exercise and build strength in your legs, arms, and even work on some of those core stomach muscles. The next piece of equipment is a stretch band. These bands you can pick up quite easily. You can pick them up from Kmart, from Rebel Sport, and maybe even from your local physio. Just to let you know that the darker the band, the more resistance. So the lighter the band, the less resistance. So if you're just starting back to doing some strength building, you might find using the lighter coloured bands more suitable. And then as your strength increases, you can change the band to a darker colour. So let's get started. We're going to start with doing knee squeezes. These are one of my favourite exercises to do. They're a really simple exercise and can be done seated or laying, depending on what you feel most comfortable with. They're actually based around a Pilates exercise, and they're designed to build that strength back in your thigh muscles, buttocks and tummy area. So those muscles that we really need to help us get up out of a chair, which can often be a struggle for a lot of people. So to start the exercise, you want to sit on a chair with your feet and knees hip width apart. And once again, you're going to try and be aware of that good posture, sitting up nice and tall, which will naturally make you use more muscle. You're going to take the ball and place it between your knees, keeping those feet flat on the floor. Remember, you're breathing when you're exercising. We're going to try and breathe through the movement so we're not holding our breath. We start by just tensing the muscles of our thighs and squeezing the ball, holding for a moment, and then this is the hard part, slowly releasing. It's a nice squeeze, hold, slow release. As you're doing this exercise, you want to also feel the muscles of the buttocks and even in the tummy tense. So breathing in as you squeeze, hold, and then exhale as you release. Once again, really important, you're not going too fast with this exercise, and you don't have to try and pop the ball either. you want to work at about a 60% effort with this exercise, squeezing, holding, and slowly release. Now you might find, especially on that release of the exercise, you get a real shake in your legs. Now that's really normal to get for the first few times of doing the exercise. And the reason for that is the first few times we do an exercise, we don't actually get a lot of muscle improvement. What we get is our brain connecting to our muscles and creating stronger neural pathways. And that shake is just the muscles learning what they're doing. So that's okay. You might want to start by just doing between 3 and 6 of these, then stopping and having a rest for 30 seconds to a minute, and then trying to do another 3 to 6. Strength exercises don't have to be done every day. You might find doing these 2 or 3 times a week is enough for you. Often recommend if you're doing hemodialysis treatment, you may find that doing the exercises on your non-dialysis days give you the best results. So let's just go through the knee squeeze again. We're going to have our feet flat on the floor, knees and hips width apart here, sitting up nice and tall. We're going to breathe in as we squeeze, tensing our buttocks, tensing our tummy. Hold the squeeze for about 1 to 2 seconds and then slowly release. Nice big squeeze, hold and slowly release. Being aware of your posture while you're doing the exercise. Once again, only work to what you feel comfortable doing. Stop and rest whenever you need to. You can slowly build up how many you can do over a few weeks. We're going to continue with 2 more exercises for your leg strength. So this is where we'll need our stretchy band. So once again, we're going to be sitting up on our chair. We're going to place the band underneath the foot, so it's just below our toes and supporting the middle of our foot. You want to pull the band back so you add some tension and get your leg as straight as you feel comfortable doing. Then all you're going to do, keeping that tension, keeping your body nice and straight, being aware of your posture and breathing, just pushing your toes away, holding for a second, and then pulling your toes back towards your body, holding for a second. Basically, we're doing those push and pull exercises we were doing at the beginning for our feet in the first video. So this is creating a little bit more tension by adding the band, which is helping work those muscles in the calf and the shin. And these are the muscles we need for good walking function. It's also really good for supporting good knee health because we're working those muscles that build up, that join into the knee area. Once again, start by doing 3 to 6, then you can change to the opposite foot. If you've got obviously any wounds or injuries, you might find that you can't do the other leg, but you listen to your body and you do what's right for you, as we've said through these videos. So push, hold, pull back, hold, trying to keep that leg as straight as possible, holding onto the tension of the band. Once again, listening to your body, you don't want to work to pain. You might find a challenge, you might find the muscles feeling quite tight or fatiguing. That's okay. Working at your own pace. Once again, you can have a little rest and do that again on each side over a few weeks, building up to how many you can do. The next leg exercise using the band is often called a leg abduction exercise. So basically what we're doing is the opposite of what we did with the ball, where we're going to work on those muscles of the thighs and buttocks and a little bit of those tummy muscles. So with this one, we want to start with our feet and knees as close together as you feel comfortable. You may need to sit a little bit more forward on your chair than normal. We're going to take the band and we're going to tie the band just above the knees. Now you can use ring bands. You might have seen the bands that are joined like a ring. To use those, they can be a bit of a challenge to get on and off, but they are the other option to do. Make sure you do tie the band so you can get it undone. That's always a bit of a challenge. So keeping our feet and knees in that start position, sitting up nice and tall, being aware of your posture. You're just going to separate your knees, hold and slowly return. Now it's not a huge movement. You're not trying to really fully open the legs, but because we want to be keeping the feet in that position. You might find your feet roll out a little bit, and that's okay, as you can see what I'm doing here. Breathing in and exhaling, being aware of that posture. When we're doing strength exercises, it's really important that we go slowly and steady, not fast movements, because that can have a big effect on our joints. We're trying to work our muscles and not impact our joints here. And together. Good. Once again, start off with doing 3 to 6, whatever feels comfortable for you. Stop and have a rest when you need to, and then you can always try and do a few more. So we're going to try those exercises using the ball and the band for our legs in another position, in the laying position. Now, for many of you, you won't feel comfortable getting on and off the floor, and that's okay. You don't have to do these exercises on the floor. You can do them on your bed or on your lounge, wherever you've got a nice, fairly firm and comfortable position, and most importantly, that you can safely get on and off. So let's start with the knee squeeze exercise. So you're going to be laying, say on your floor or your bed, wherever you've got a comfortable position. You may need to put a pillow under your head for support if you feel it's uncomfortable to lay completely flat, and that's okay as well. But try not to have too many pillows where you're putting too much pressure on your neck area. You're going to take the ball and place it between your knees so your feet are flat on the surface that you're laying on. Try and get yourself into a good laying posture. We're still going to be thinking about our breathing here. We're going to do a nice big squeeze, hold the ball, and slowly release. As we're doing that exercise, we're feeling our muscles and our buttocks and tummy tense slightly, and slowly release. Remember, you don't want to be squeezing with 100% effort or feeling any pain or discomfort. If you feel any pain in your back, hips or knees when you're doing this, it means you're going too hard. So you just want to reduce the intensity of the squeeze. So squeeze, hold and release. Feet are nice and flat. Try and relax your chest and shoulder area. And you're just thinking about that breathing as you do the exercise. Nice big squeeze, hold and release. This exercise is also really good for improving bladder control. So for clients who've had a transplant who might be struggling with that change in fluid intake, and you're struggling with some getting up lots of times during the night, or bladder control during the day when you're out and about, doing this exercise regularly, especially in the laying position, can work the muscles that support the bladder. So a really nice exercise for that as well as building that strength. We're going to go to the band exercise now. So with that ankle flexion and extension, you can lay on your bed to do this and even get some support with your pillow. If you're on the dialysis machine, some people I know like to do this while they're dialyzing or while you're doing your peritoneal dialysis. So you're going to have the leg nice and straight, place the band under the toes so it's wrapping through the middle of the foot. Hold that tension there, and once again you're just going to push your toes away and then pull back. Push your toes away and then pull back. Remember, working to the level that you feel comfortable. There shouldn't be any pain when you're doing it, but you are going to feel those muscles working. Once again, only do as many as you feel comfortable doing. A good starting amount is 3 to 6, and you can build up from there. Swapping to the other foot, doing exactly the same thing. For some people, they actually find it more comfortable in this position rather than the chair position. So it's a good idea to just play around with the exercises and try both the laying and the seated versions of these, so that way you can work out what you feel most comfortable doing. For most of us, it's going to be much easier to pop our feet and knees as close together as you feel comfortable getting them, tying the band first before you lay down. Otherwise, it's a little bit more of a challenge. Get yourself into that laying position. Pop your feet up so they're together. Remember, if you need to have a pillow under your head or neck to support you. And you're just going to separate the knees and then slowly come back together. Now, it's not a huge movement. We're not trying to open our legs all the way up. It's just extending them as far as you feel comfortable and then slowly coming back together. Being aware of your breathing. You might be a bit shaky, remember, especially in those first few times of doing this exercise, because we're really working a lot of muscle groups here. We're using our buttock muscles, our thigh muscles, and our tummy muscles all in one exercise. So if your muscles are a bit weak, they're going to feel challenged to start with. Once again, stop and rest whenever you need to. And then just take your time, especially if you've got some blood pressure issues, when you're coming back to a seated position. Don't rush. Just take your time. Well done.